Welcome. In this section, we will cover occupational health risks among immigrant workers. So why are immigrant workers at an increased risk of workplace hazards? Well, immigrant workers are recognized to be among the most vulnerable members of society. This is because they often engage in what are known as 3D jobs, which are dirty, dangerous, and demanding, sometimes degrading or demeaning. These workers are often hidden from or invisible to the public eye and from public policy. These workers are also more likely to be employed seasonally or to hold temporary jobs compared with native-born workers who tend to be employed year-round. Temporary or seasonal workers are not usually represented by unions, which means they have fewer protections than full-time workers. They are also often ineligible for workers' compensation benefits or do not receive benefits for which they are eligible. Immigrant workers also work for less pay, for longer hours, and in worse conditions compared to non-immigrants. They are also subject to human rights violations, abuses, human trafficking, and violence. Most importantly, immigrant workers may take on greater risk on the job, do work without adequate training or personal protective equipment, and often they do not complain about unsafe working conditions out of fear they may lose their jobs. Precarious employment is associated with higher rates of poverty, wage theft, a lack of overtime compensation, and no health or employment benefits. Unfortunately, the greatest impact falls on workers who lack work authorization and are at risk for losing their jobs or being sent back to their home countries. Immigrant workers also face greater environmental exposures compared to non-immigrants. Examples of these include physical hazards such as temperature extremes and chemical exposures. For example, it is recognized that immigrant workers are often employed in outdoor occupations such as agriculture and construction, exposing them to extreme temperature conditions, increasing their sun exposure and risk of heat-related illnesses and even death. It is reported that farm workers are 4 times more likely than workers in other industries to experience heat-related illnesses. And according to data from the Centers for Disease Control and Prevention, or CDC, farm workers in the United States are 20 times more likely to die from heat-related causes compared to other workers. It is important to note that climate change is expected to exacerbate and increase the risk of illnesses and mortality from temperature extremes. A study conducted by researchers at the University of Washington in 2020 reported that U.S. farm workers will experience an increase from about 21 days of working in unsafe temperatures per season to an average of 62 days by the end of the century, which is nearly 3 times as many. This also has implications for renal health, as workers in hot environments who don't have steady access to clean water for rehydration are potentially at a greater risk for kidney disease. Cold temperature extremes may also pose a hazard. For example, in the fishing industry in Alaska, an estimated 3/4 of the workforce is made up of immigrants. These workers experience high rates of injury related to cold temperatures and frequent contact with ice-cold water. As noted previously, immigrants also face greater environmental exposures to chemicals such as pesticides, with some groups experiencing more disparate exposures. In the United States, it is estimated that approximately 75% of farm workers are Latino migrants. This workforce experiences exposures to many pesticides. It is reported that over 1 billion pounds of pesticide active ingredients are used each year in the United States to increase crop yield and meet food demands, and that up to 25,000 farm workers suffer acute pesticide poisonings every year in the United States. However, the real number of acute pesticide poisonings is likely to be much higher owing to incomplete reporting. The widespread use of pesticides in agricultural fields results in ubiquitous exposures, particularly among farm workers, due to pesticide drift from treated fields to nearby homes, through the take-home exposure pathway, which is when workers who have applied or come into contact with pesticides carry the pesticides into their homes on their clothing or shoes, potentially exposing other household members, including their children, and by consumption of contaminated food and water. Chemical exposures are also common among other workers, including industries dominated by immigrant workers, such as cleaning and housekeeping, as well as nail salons and dry cleaning establishments. Workers conducting cleaning services are routinely exposed to chemicals and cleaning agents that can lead to skin conditions and even cancer. In addition, they regularly work with hazardous chemicals containing ammonia and other irritating solvents, which may impact lung health. Nail salon workers are often exposed to many carcinogens and reproductive toxicants, including formaldehyde, toluene, and phthalates. One study conducted by researchers of the University of Toronto reported that nail salon workers' exposure to flame retardants and plasticizers was 30 times higher as compared to exposures within households from everyday products, and also 10 times higher than electronic waste facility employees, while those working in dry cleaning establishments are exposed to hazardous chemicals, including perchloroethylene, which has been linked to liver damage and is a potential occupational carcinogen. As noted earlier, immigrants are often employed in precarious or insecure jobs, meaning there is no employment contract, so workers often accept the dangers or risks of the job without complaint for fear of losing their job or even being deported. Stress from fast-paced and inhuman environments is also prevalent in some industries, including the poultry industry. For example, immigrant workers in poultry plants report constant pressure from their supervisors to keep up with production and getting the job done quickly and cheaply without regard for worker safety. This demand for quick work often results in increased rates of injury from repetitive motion or accidents and psychological distress for workers. These harsh conditions of long hours without breaks or high production quotas also limit workers' access to adequate sanitation facilities, which undermine their right to safe and healthy working conditions. In fact, it is not uncommon for supervisors in the poultry plants to refuse to allow restroom breaks for workers or to require workers to wait for replacements who may never come before they go on a restroom break. So there are reports of workers wearing diapers as a result of this. Such conditions may also amount to gender-based discrimination at the workplace, as a right of health to women workers may be impacted by policies and practices that may disproportionately impact pregnant workers by limiting regular access to restroom facilities. Lastly, it is important to highlight that workplace stress is associated with poor mental health outcomes among immigrant workers. This stress may be further exacerbated by fear of job loss or deportation, especially among workers without legal work authorization. Another factor that places immigrant workers at an increased risk includes lack of safety standards and lack of enforcement. While regulations to protect workers exist in many of the industries that employ immigrants, employers do not always follow safety standards. For instance, immigrant workers on some poultry farms report that while personal protective equipment, or PPE, is often supplied by employers, it may be up to the worker to actually purchase the equipment. Also, workers themselves do not always follow safety rules, electing not to wear PPE due to poor fit or the belief that this personal protective equipment may interfere with their work. Additionally, safety trainings may be missed owing to the often migratory behavior of immigrant workers or may not be available in the worker's native language. Also, even when available in their native language, these may still be inadequate. Limitations in English language ability may contribute to poor health outcomes or greater disparities, as workers who have lower levels of English language mastery work in riskier jobs and may not understand safety trainings. Now, workplace abuse may take on many forms, including physical, mental, and sexual abuse, as well as harassment to what has been termed benign neglect when managers fail to implement or enforce safety measures. Additionally, the actual or perceived lack of legal protections for immigrant workers can also increase their exposure to abuses in the workplace. Workers' acquiescence to working longer hours or working in unsafe conditions. Workplace abuse also leads to poor mental health and increased risk of workplace injuries. One Australian study conducted in a sample of over 60,000 workers reported that moderate and high psychological distress increase the odds for workplace accidents and decrease the odds of workplace successes. So increasing globalization has also led to a dramatic increase in international human trafficking or forced labor, with the United States being one of the primary destinations for trafficked persons. Human trafficking is a modern form of slavery where women, men, and children are recruited or obtained and then forced to labor against their will through force, fraud, or coercion. Trafficking victims are often lured by false promises of decent jobs and better lives. In the United States, victims of trafficking are almost exclusively immigrants and mostly immigrant women. The average age of trafficking victims in the United States is 20 years of age. Human trafficking of men also exists in select industries around the world, such as in the fishing and mining industries. The U.S. Department of State estimates that between 14,500 and 17,500 people are trafficked into the United States each year. However, these numbers do not include the many individuals trafficked within U.S. borders. There are several conditions that pressure women to migrate and make them particularly vulnerable to trafficking. These include poverty, gender discrimination, illiteracy and low levels of education, regional conflicts, and a lack of job opportunities, which affect women in greater numbers. Traffickers also often confiscate legal documents, demand payment from the worker, and pay very low wages. Trafficking victims are exposed to multiple forms of abuse and exploitation, often experiencing physical and psychological abuse, including beatings, sexual abuse, food and sleep deprivation, as well as threats to the workers and their family members and isolation from the outside world. These abuses lead to long-term health effects, including post-traumatic stress disorder, or PTSD, sexually transmitted infections, and other somatic illnesses. In the United States, immigrant women and children are particularly vulnerable to the deceptive and coercive tactics of traffickers because of their lower levels of education, inability to speak English, immigration status, and lack of familiarity with U.S. employment protections. Furthermore, they are vulnerable because they often work in jobs that are hidden from the public view and unregulated by the government. So in what industries do forced labor and trafficking victims work? Well, forced labor and trafficking is an endemic problem in those industries that lack government regulation or oversight, and where, as a result, employers often fail to comply with U.S. labor laws. Forced labor and trafficking in the United States are most prevalent in domestic service, agriculture, sweatshop and factory work, restaurants and hotel work, and in the sex industry. The majority of trafficking cases in the United States are reported in New York, California, and Florida, which are states with high concentrations of immigrants. So what drives the trafficking industry? Well, trafficking of humans is driven by a global demand for cheap, unskilled, exploitable labor. Global profits from forced labor total an estimated $44.3 billion each year. Human trafficking is now the second largest criminal industry worldwide after drug trafficking and the fastest growing criminal industry. A number of factors contribute to the supply of trafficking victims, according to the U.S. Department of State, including poverty, perceived higher standards of living elsewhere, lack of employment opportunities in the immediate area, organized crime, violence against women and children, discrimination against women, as well as government corruption, political instability, and armed conflict.